You know, if you asked me this question 30 years ago, one would say that the strong and healthy skin is the good condition of dermis. We speak about microcirculation, we speak about extracellular matrix, we speak about the fibroblasts, the cells within and activities of these cells within a dermis. If you asked me this question 15 years ago, we would certainly say about the epidermal conditions. It is the upper layer of the skin and the condition of the stratum corneum, the form of keratinocytes, the condition of intracellular lipids is of great importance, what we call skin barriers. But nowadays, speaking about the healthy skin, we have to speak also about the microbiota on its surface and inside the skin. And if to answer now, it is a good balance between the barrier functions from one side and microbiome from another side. This is a healthy skin. Skin is aggressed severely as far as it is the organ which is facing everything external. That is why we have a special term, exposome, that means the exposure of some aggressive factors. They may be associated with UVA, UVB, climate, irradiation, and many other things. But what is in a focus from cosmetic dermatologists nowadays, that some cosmetic procedures may cause the changes of the skin barriers. This is also very important. Even the inappropriate skin care may cause the damage of the skin barrier. And when it happens, it is studied very well. When the skin barrier is damaged, the change of the microbiome appears. So we have the situation which is described now like a dysbiosis. And this dysbiosis induces the innate immunity, and it is followed by the inflammation. And this is a very simple way to explain why some of us have sensitive skin, why the patients develop the exaggeration of rosacea, acne, and atopic dermatitis, perioral dermatitis, and lots of other inflammatory skin conditions. So the counterinteraction with between the barrier and microbiome. This is a very important topic nowadays, because we have a lot of cosmetic procedures, and it is a state of the art by nowadays that the cosmetic procedure is effective when it is, unfortunately, when it is invasive. And certainly a variety of lasers, chemical peels, radio frequency, they do give the good aesthetic result from one side, but it has been proved that it damages the skin barrier. Some of cosmetic procedures, such as medium depth chemical peels or full laser abrasion, they extensively damage the skin barrier. Some of them, like superficial chemical peel, radiofrequency, needles or injections, they also do it, but they do it on a lesser extent. But they also damage the skin barrier. And we face a very good situation from one side, because the science develops, and all the cosmetic procedures which are effective nowadays, they should be safe. And all the cosmetic procedures nowadays and all the studies are aimed on the diminishing of the downtime. And in this case, dermocosmetic may be very useful, because we may face the sad situation in that case when the person, the doctor, ignores the post-laser skin care or post-peeling skin care. Because as far as the barrier is damaged, it causes the inflammation. because it is a standard way when we have the disturbance of the barriers of different reason. We have the exertion of interleukin-1 alpha. It is a special substance which induces the inflammatory reaction within the dermis. So we have to suppress this reaction, because if we do not suppress it, the persistent dryness, persistent erythema, and unfortunately post-inflammatory hyperpigmentation will take place. And from this point of view, it is a special role of dermocosmetics. So what to prescribe after treatments? First of all, it should be the SPF. It should be the sun protection, and not only SPF, so it should be the protection against both UVA and UVB, in order to predict and to stop the post-inflammatory hyperpigmentation. It should be a very gentle cleansing, even sometimes without the use of water. It is also very important. And also it should be the moisturizing. It has been proved that to add the good moisturizer into the day cream is to diminish the inflammation, diminish dryness, and diminish all consequences, bad consequences of the procedures. Skin repair mechanisms were very well studied within last decade. And you know what happens? First of all, the active keratinization starts, and the producing of extracellular lipids is rapid in this moment. And it happens even in several hours after the barrier disturbance. From this point of view, we have some problems to settle, and we can add into the dermocosmetical cream or some other formulation some agents, active ingredients, which may stimulate keratinization, or we may add some lipids which may restore the skin barrier and restore the individually produced skin lipids. But as we know nowadays, the disturbance of microbiota, the dysbiosis, may take place. And from this point of view, it's very interesting to induce, to include in cosmetic agents some prebiotics and probiotics. As for prebiotics, we never think of it, but even the components of the thermal water may play a certain role like a prebiotic, or the component of the vehicle itself. And the probiotics is bacteria or changed bacteria, which may act on inflammation, on the innate immunity, and modulate it. This is a very interesting way to protect the skin.